because of ABC, but yet the doctor or the expert just needs some money. So what are some of the measures you are putting in place to reduce abuse of that?
Thank you. I'll talk about the two things. I'll talk about what we are doing and why we do it that way. What medical council does. So for us, what we are doing, just as I mentioned, for you to say that this pregnancy must be terminated, you start hearing the videos decision. That's why in hospitals, there are those patients where you see a group seeing and discussing. Yes. When you're in the hospital, pray to God that you're seen by one doctor and doesn't get call others to come and see. People are medicine, you say there's an interesting case there. So someone who's asking me, interesting to who? It's interesting to us, but not to the relatives of the patient. So if that's the scenario, a group must come and discuss, and they all agree that we should terminate the treatment. Sometimes, as I said, woman is 48. This is her first pregnancy. Maybe she tried IVF 3 times. This is the 4th time that she picked. How much money does she spend? Now at 22 weeks, you're having, you see now pressure is high here. It's not really to remove. Someone has ever said it is okay, I'd rather die, but I live this baby. So it's not straightforward. By the time of that contribution, really, the health workers and the family have all agreed that it should come out. If it is the reason is that the baby cannot live, it means that the obstetrician has seen a neonatologist, a doctor for babies, newborns, has also come and seen. You've done all the scans, not one scan. Right? When you do a scan and do something abnormal that may make such a big decision, you need a repeat scan by the most qualified person in that region. And you are speaking the same thing, and the gynecologist as well as the neonatologist, you all have should be terminated. That is when you terminate. Now, what does medical council do to safeguard? Ebola test. Ebola. The Ebola test. In the Ebola test, they get a scenario. You say, maybe this woman came, she had the previous scar, she has never been operated, oh now she's a criminal. She comes, she's in labor. Actually, this woman died in your facility. Now they've taken to medical council. I think I hope you listen to the Ebola test. So, they narrate this story, your story, to someone of your same level at a facility of your level care, and they ask that person what he or she should have done. This matter. What do I mean? You have given only for the mother died there. They give a story of what happened to someone who is also associate consultants like me. At also a hospital, maybe in Bali. If you had a mother like this, then what do you do? Then someone says, me, yet has no power. And if I immediately, and what did this one do? He observed the mother, started trying to cut that the baby can. Yes, I can now for you. You get. So you must do something that you learned in school. That is in law. That is the policy. So that even when they ask another person, the person says, I should have done. The simple example is, if in Uganda the woman has had 2 previous scars, operated on face, she's not allowed to try later. All subsequent pregnancies must be planned scissor. Sometimes they come when they're in labor. Because they took some herbs, someone lied to them. They say, you can even try. So they come when they're in labor. Now the law is, take her to theater. Even when she's to push, it's okay to push when she's on the table. Where did that also come from? You realize that, yes, some of them can push. But even when they get complications, then they push and open. They trans after the bladder, and the operation becomes even more messy than what you should have done if you just remove the baby. So it's not that they can't push, they can, but they tend to get a lot of complications. Now, if this woman pushes in your word, doctors and dies, they will ask another person, social consultant, if you this situation, a mother comes to that part, the baby is horrible severe, then what do you do? If this one says, then that will say that. And then she pushes, she like she's on the table. Because when after pushing, you want to have for 2 hours closely to ensure that she has not suffered complications. She has not had any further you open and you don't say something different, then you're okay. So that's what medical counsel does to safeguard.
No, I'm beginning to enjoy it. However, I want to ask about some ethical issues that guides your operation as medical personnel at your level. When a lady comes, whether she is who or what, the circumstances under which she got pregnant is not your business. Yours is to work on her as the patient. Now, let's create a near true situation that this is a lady married and the husband is outside for studies. She conceives and she wants to terminate the pregnancy. Now the husband comes back and rumors, and she proves that the rumors are true. He begins his investigation and finds that this is Dr. Aggrey America who performed this activity.
Activity of terminating,
yes,
which is not allowed.
Yes. Now he will hire counsel to begin investigating and drag you to the court of law. How will you defend yourself?
I will not, and I will be in, because the procured abortion is not allowed.
She didn't tell you about everything.
Okay, sorry, that's just not. But we said procured abortion is not allowed. Whether you come with your husband, by the way. Quite often, people come with their husband, it's a couple saying, no, they're even our friends. Quite often, oh man, if we are please, they're our friends. But then just now use their friendship to support them. So we don't. Of course, we know they go to some other places and they do whatever they do. Then when they come, someone talk about drug shops. Now what happens, these women even know which medicine causes abortion. So they go and take, they start bleeding. Then they come to us. When you come when you're bleeding, I have no problem. I attend to the emergency. Because bleeding is an emergency. But post-abortion, the emergency. So I have to manage the emergency. But everything must be documented, and I need some statements like a scan, that I can have my file clear.
And maybe last thing like this. You're a Christian.
Yes, I am.
And they are Muslim doctors.
Yes.
The Quran and the Bible talks about life being sacred.
Yes.
If somebody comes and says, I was raped,
Yes.
you're a human being.
I am.
And you're sympathizing with this lady. I really don't want this. I was raped by a suspected drug addict. I don't want to carry because the trauma will be in my life forever. She wants to know.
So I think you need to go and read the harm reduction model. Now that's why it comes in. And I didn't over discuss it. I know some people are saying even what we call as the end of the woman's life can be that she conceived and now she's in depression because the man left her. Because they know that she wants it out. Some people are sneaking in that because then there's not only the kidneys and the what, but even harm reduction model. I don't want to discuss it because maybe it was not really controversial, but in such situation there is something we do. Maybe we may not overtake this, but we counsel this person, trying to support her in what the way discussed. But some people will refuse and refuse and refuse and refuse. So in such situations, you can tell them in the abduction mode, which means you are not yet accepted. So we tell someone the medicine to use, the dose to use. Yeah, because you're reducing harm. You know already she's going to look for someone who is going to do it, and you don't know what that person will do exactly. So tell her the medicine to use, the dose to use, and give her, she should have contacts with the hospital in case she's bleeding too much or where to go. So she goes and buys it. Because when bleeding starts, the law is okay with us to manage the emergency. Because we know exactly what is happening, that people are doing abortions, and unsafe abortions are killing women.
Maybe doctor about the
Let me pause.
Your lecture seems interesting. Sometimes the kind of care you're speaking about, we can easily get it in private health facilities, but in the government health facilities, the numbers you people sometimes receive are quite many. Do you think under the post-abortion care, mothers can get this counseling? Because sometimes the numbers in government hospitals where most of these cases happen seem to be quite many, and you look at, so sometimes you even sympathize with these health workers. Omulabanga are fatigued and, yeah?
That is true. Most of the numbers is a little tricky, but every hospital has what they call the abortion room. Not an abortion room. Actually, it is post-abortion room, yes. So people that are there know which things to talk about. So sometimes we don't give a lot of time, but family planning. Even there's a family planning kit in that room, which has an IUD. You can put IUD if the pregnancy was clean. After that, you can put that in. Or you can put for her implant. So it is there. But sometimes it's not too much time that we give to people. And sometimes because of privacy, someone can't over express themselves. That's why we quite often tell them to come back. Like after 6 weeks, and then you come back.
What are some of the conditions that's what you call mystery?
Yes.
Because we are
Unintended abortion.
unintended abortion.
Yeah.
Because
Or
we are
spontaneous.